Moving forward tonight now, new details are coming to the surface in the case of Paul Bumbalow. That's the Utica man who admitted to killing 3 of his family members back in 2015. His counsel heading back to a courtroom this fall, and this time it's for a lawsuit that Bumbalow filed against the Mohawk Valley Health System, the facility that examined his mental health before the attack. Eyewitness News reporter Julia LeBlanc takes us back to that initial lawsuit. Julia.
Angie, Bumbalow filed the lawsuit last year, claiming he did not receive a proper psychiatric evaluation from the staff at Faxton St. Luke's. Bumbalow insisting he was showing signs of obvious psychiatric conditions at the time of his release from the hospital. We took a closer look at how that examination process works.
3 years ago, Paul Bumbalow was arrested and sent to the hospital for a psychiatric observation. After being sent home the next day, he killed 3 of his family members. The Mobile Crisis Assessment Team in Utica did not deal with this specific case, but they do take mental health calls regularly.
They can make a phone call, they can talk to a crisis counselor on the phone. If the crisis counselor, and will always offer to go see them.
Social workers may then perform a risk assessment based on the problem. Here at MCAT, it's often in relation to suicide.
You're looking at the likelihood that it could happen. You're looking at their intent. What's the motivator? How strong is it that they want to kill themselves?
Professionals looking for signs of passive and active suicidal idealization. Active being more pressing, as the caller has likely decided suicide is their only option.
Passive says, okay, I have the thoughts, but I would never do anything for a variety of reasons. I have what we call protective factors.
If the social worker determines the caller is at high risk, it's off to the hospital with a follow-up later on. If this part is involuntary, ambulance and police are called. They perform a mental health evaluation to determine if the person meets 941 criteria, an emergency allowing police to insist on a hospital visit.
Then the doctor will come and evaluate who's ever on. Then a social worker is often asked to evaluate, and then they may call for psychiatric consult. They may have enough to make a determination, and then they kind of go from there.
A process Troutman-Zello says is detailed, with release times varying from case to case. Though tedious, she says it's an essential service for our community.
MCAT really saves lives, as does the clinic. I mean, we get people that walk in here and say, I want to hurt myself, and we evaluate them right on the spot, and we get them where they need to go.
The MCAT crisis line is open 24 hours a day, 7 days a week, and those services are all free. Reporting, Julia LeBlanc, Eyewitness News.